Good evening and hi to all of you joining us from home, work, the bus, various locations. My name is Sarah O'Connor and I am the CEO of the Asthma Society of Ireland. I just want to say thanks to all of you for joining us, and I can see our numbers are coming in there as Ellen and Martina are very kindly approving you all from the waiting room. I hope everybody's doing okay on this slightly dull and overcast Tuesday evening here in Dublin, and hopefully maybe it's a little bit nicer with any of you down the country. And obviously our big hope is that you're all surviving and doing okay in the back to school week or two, which can be a big challenge for all of us mentally as well as physically. We are going to get kicked off, I think, pretty quick smart, because we want to make sure that we run to time where possible. So what I will do, if it's okay with everybody, is I'll just talk you through what we're going to discuss this evening, just so that people have a sense of the timings and what we'll be chatting about. Initially, obviously, it'll be me saying hello. Then I'm going to pass you over to Mary MacDonald. Mary is an advanced nurse practitioner. She's based at the Children's Health Ireland Hospital in Tallaght University Hospital. Mary has been involved at the clinical programme level with myself for a number of years, and she's been involved for well before I was on the clinical programme as well. She is somebody who is really passionate about asthma and asthma management, and about boosting children's competence and confidence in managing it, and also parents' competence and confidence. And I think you'll find her her introduction to what asthma is about and the asthma basics really helpful. We are going to switch over to a video from Ingrid, where Ingrid talks to us about her experience with asthma. Ingrid is from Howth and she's aged 9, and she has done a video for us kind of explaining about her perspective, which I think you'll find interesting. And then we are going to kick over to Aoife Lee, and Aoife is going to talk to us about how to support parents, you know, how to support yourselves, I suppose, for any of you who are dialing in as parents and children with the return to school. And Aoife's talk will touch on asthma, but also how it fits in around the routines, the return to school, what that looks like, what that feels like, and to give you maybe some, you know, some good basic supports and some practical measures that can really help. Aoife is a parenting coach and a parenting expert, and she runs an Instagram and a blog called Parent Supports. I think I've got that wrong, so she'll correct you when she's talking. And I think you'll find her piece really grounded and really helpful. And then we are moving over to Samantha Mccabe. Samantha works on our advice line service and also on our WhatsApp messaging service. She is a clinical respiratory nurse specialist. She is fantastic and really great at being very practical. She'll talk you through some of the services that we can offer that can help you through the next few weeks and obviously in the long term. And then we are going to kick it over to Q&A. So we have a lot of questions in at the moment. As Ellen says, at the moment we have 4 foolscap pages, but we are opening the questions to yourselves, and you can submit any questions on the chat message there, and we will take them as we go. We will attempt to answer them thematically under the different themes. If it's possible that we don't get through all of them, we'll run another session in another week or two and we'll answer all of those. It may be the case that some of the questions that you ask are of a kind of a technical nature to do, for example, with medication recommendations. If that's the case, I'll explain and we'll talk through it, but we might recommend that the best protocol might be for you to use our WhatsApp messaging service or our advice line service to get a really good chat with the nurse around that particular topic, because, you know, a 1 or 2 sentence answer on a webinar maybe wouldn't cover the level of support or advice or guidance that you might need around something like that. But I suppose really what I wanted to say this evening is you are very welcome. We're absolutely delighted for people to take a little bit of time out of their lives to think about asthma management at this juncture in the year. September is really important in terms of asthma management, and traditionally clinicians, whether they're at nurse level like Mary and Samantha, whether they're at GP level or whether they are at consultant level, they see what's called, you know, the September spike. And so really what it means is that children and adults find that their asthma can be harder to manage in September, and it's a mixture of things. It's things, I suppose, like you know, the return to school, obviously. It's traditionally cold and virus time of the year, and also one of the bigger problems is that the temperature can drop, and cold air obviously can be a trigger for asthma. And what it means is that we would see people who are visiting their GP more, who are visiting GP out of hours services, who have to visit an accident and emergency section in their hospital, or who may have to be admitted to manage their asthma. And so the whole function of this webinar and of our Back to School awareness campaign is really to give people guidance and support to make sure that they improve or they boost their asthma management at this time of the year, to have a good and safe September, but also to get, I suppose, some of that asthma management stuff right throughout the winter when it can be challenging for people to manage it. What I'd really like, I suppose, is to try and make this webinar as safe a space as possible. Certainly when I've been talking to both Mary and to Samantha about what they're hearing or feeling from parents at the moment, or from patients across the board, is that there's a huge amount of anxiety in play. People, I suppose, are very worried about this back to normal return that we have at the moment, and what that means for them, for their families, for their child, for their school. And what I want to say is that, like, we hear you, we know that it's an anxiety inducing time, and we're here for you. So Samantha will talk through the services that we can offer, but what we want to say is you feel free to send us a message, either a question on the service on the webinar tonight, or to use our WhatsApp service, to use our website morning, noon or night, or to use our advice line service, because we're here to help and guide you, to give you advice and guidance as best possible, to make sure actually that we can remove some of that anxiety and kind of put you in the driving seat of you or your child's asthma, to make sure that actually you realize that you have the tools at your fingertips to make this a really good and safe September. So that's, I suppose, the proviso is this is the safe space. There is no dumbass question about asthma, because we've heard them all, and actually we often ask them of ourselves and of each other, and all dumbass or highly intelligent or every question level in between, very, very welcome here this evening and through our services throughout. So what I'll do is, if it's okay with people, I'll kick over to Mary, and just again to say thanks so much to everybody for joining us, and I'll be fielding questions on the Q&A section later. Thank you.
So thank you, Sarah, for that informative and encouraging introduction. And I'm delighted to give this kind of basic whistle-stop tour around asthma. So the first question is, what is asthma? Asthma is a chronic, actually this is not on slideshow, I'm putting in slideshow, beg your pardon. So asthma is a chronic or long-term illness, and it's very common in children. It varies from season to season and from year to year, and results in symptoms such as coughing, wheezing, or shortness of breath. The thing about asthma is that as well as being variable, it's also unpredictable and can result in an asthma attack. And this is what we want to avoid. There is no cure, but symptoms can be controlled. Triggers can be allergic, like dust or cat or dog or pollen, or non-allergic, like passive smoking, exercise, or even emotion. Some children, by the way, grow out of their asthma. So what's happening to the lung when you have asthma? What's going on in there? There's inflammation on the lining of the airway. Your lungs are a series of tubes, and on the inside of those tubes, instead of having a kind of a pink shiny lining, that lining can be red and inflamed. And with that, there comes a mucus buildup in the airway. And also, because of that, the muscles are working harder. And so you have this thickening and enlargement of the muscles. And all of this reduces what we call the lumen, or the amount of space through which the air gets in and out from the lungs. And this is what makes people feel uncomfortable. And then what happens with all of that is you get a spasm of the muscle around the airway, which narrows it even further. And this results in symptoms or even an asthma attack. So the question I think that many people ask is, does my child have asthma? Does my child really have asthma? Well, there's no single asthma test that can be done. And the diagnosis is based on symptoms that I'd mentioned before, like a cough, wheeze, shortness of breath. And we try to find evidence for what's going on in the lung using a lung function test. However, lung function tests are only abnormal at the time that there are symptoms. And if you remember, I said asthma was variable, and also they can only be done in older children because young children wouldn't be able to carry out this test. It's quite difficult. So we look at whether the child responds to medications such as inhaled corticosteroids or even oral steroids. And if they get a response with oral steroids to their symptoms, then this could be looking like asthma. If there's a family history of asthma, especially on mum's side, we're getting nearer to the nub of it. And if there's a history of eczema, hay fever, food allergy, dust, pollen, or animal allergy, this again adds to the whole picture. Sometimes there is a need to rule out other illnesses, so we may do further tests. But a lot of the time it's reasonably clear. So what are the medications? Medications in asthma are prescribed according to guidelines that are research-based, and they're updated very frequently. The treatments are prescribed in a stepwise approach, increasing or decreasing as they're needed. So with increased symptoms, you may need to take more medication or at different times of the year. The initial step is step 1 for mild asthma, and the medication might just be using a reliever inhaler as needed, or a combination of a reliever and a controller inhaler as needed. And this is a new idea that's come out recently with research that shows using a combination inhaler as needed can be safer because it reduces the amount of Ventolin that's used or salbutamol that is used, and it's been shown to be safer and reduce the severity of attacks. On all the other steps, generally speaking, in the treatment of asthma, you take a controller inhaler on a regular basis and a reliever inhaler when it's needed, or you take that controller and reliever together, the combination one, as a maintenance and a reliever medication. So inhaled medications come in a variety of devices, and this is always challenging. Spacers are required for children with a mask or a mouthpiece. Dry powdered inhaler devices are used as appropriate also. And there is a move to encourage dry powdered inhaler devices because their carbon footprint is lower. So medications just continued here. Your controller medication can be an orange color, a brown color, a white color, or a purple color. It usually contains a corticosteroid, or there can be a combination of a long-acting bronchodilator and a corticosteroid. Tablets that do not contain steroids act as anti-inflammatory, for example, Montelukast, which is a tablet that acts on a particular inflammatory airway that causes symptoms in asthma. These medications take time to work and you have to take them every day, but they prevent attacks and symptoms, and they need regular assessment of their effectiveness. Your reliever medication is always going to be blue. On one occasion it may be white, but mostly it's going to be blue. Bricanyl comes in white, and Ventolin and all the other inhalers come in blue that are relievers. So these medications are bronchodilators, and they work in a matter of minutes. They're taken only when they are needed. They treat attacks and symptoms. And overuse, as I've mentioned earlier, of salbutamol or bronchodilators can be dangerous because you're not treating the underlying cause. However, you should have access to your reliever inhaler at all times in case you did have symptoms that had to be treated. So asthma management routines is really about managing things in a proactive way and planning ahead. So things like keeping appointments, knowing what your child's allergies and triggers are, or taking your medications as prescribed are important. Also, don't let your medications run out. Fill your prescriptions on time. Monitor or supervise your child's medications use, and avoid triggers such as dust, smoke, animals, grass. Support and teach your child about their asthma as appropriate for their age. So with adolescents, you are moving into a certain realm that has its own challenges. And research has been done into how adolescents feel about having asthma and how it affects them. Many say that they are embarrassed over using inhalers in front of others, and they're sad because they're not able to take part in normal activities. Sometimes they can be angry because of how their family treat them, or maybe because they're limited in what they're allowed to do, or their parents are fussing over them. They may have anxieties and fears around having bad asthma attacks, or they may feel guilty about how their illness is affecting the rest of the family. They also can have concerns about relying on somebody else who may not know what to do in the case of an asthma attack. So one of the main challenges with teenagers is how they take or adhere or comply with the medication regime. And adherence is often poor in adolescents. In other words, they very often just don't take their medication on a regular basis and they don't want to. They may do this unintentionally because they forget or they're confused about their medications, or they may do it because they simply don't want to take the inhaler. They're worried about side effects, they're in denial about their asthma, or maybe they're just embarrassed. Non-adherence or not taking the medication is also linked to other health risk behaviours, which we call risky adolescent behaviours, which could be smoking, drinking, taking drugs, etc. So here I'm just talking about the transition of the child to the adult services. And this is kind of a road that a child goes on. And the transition in healthcare is only one element of the wider picture from dependent child to independent adult. And this requires education and support. So encouraging people to develop as much independence as possible, both from their families and healthcare staff, will help fill that gap to the adult service. Transition should be a planned, phased process and delivered in phases. And these phases should be introduced in early adolescence. But every child is different and each child kind of moves along that journey at their own pace. So that's all I'm going to say, that very quick tour about asthma. And I hope that you found it helpful in having some understanding of the basics. Thank you.
Thanks, Mary. That was really good download to have to begin with. We are going to kick over to hear about Ingrid and her experience of her asthma. Ingrid is age 9, she's based in Howth, and she did a video with us the week before last talking to us about her experience of managing her asthma. So Ellen is about to share that shortly, so I do a roll it there routine, but just to remind people that they can feel free to use the Q&A or the chat function to send us in questions. I have 2 or 3 of those in so far, and we'll log them and we'll deal with them when we're doing the questions at the end of the session. But roll it there routine, Ellen, if that's okay.
Hello, my name is Ingrid and I had asthma for 5 years. My asthma before it was controlled was pretty bad. Like I couldn't go for runs, I couldn't go on my bike, I couldn't do any hip hop, I couldn't do athletics. I couldn't do like a lot of things, but you actually can if you can control it. Yes, you can. Like you can pretty much do anything if you control it. What really helped me was I talked to the Asthma Society nurse on the phone and she'd give me some advice. Just need to stop, take a break if you're running, for instance, and you're just going, oh, my chest hurts. Don't just keep running, just kind of stop. My mum told me to try do some meditation and it just calms you kind of down. I used to be kind of nervous being at school because like if my mum or dad wasn't there or anything like that. Now I'm not really that bad because my asthma is controlled and there's nothing to worry about. If you want to find out more information on how to control your asthma, go to asthma.ie and there's really cool booklets for kids.
1 in 5 children in Ireland has asthma. No child should miss out as a result of their asthma. We're here to help guide and support you through our nurse advice line, our nurse WhatsApp messaging service, our website, and through a whole host of other supports that we can provide to you. You can rely on us to look after you.
Thanks for that, Ellen. I don't know if for anyone else that looked a little bit glitchy. Sometimes on Zoom, the video struggles to catch up with the audio. Now, I could hear Ingrid perfectly, but the video might have been a bit glitchy. But we will be sharing that on our social media platforms, on our website and on our YouTube channel. It might be quite useful as a way to, to sit down and to begin to talk to your child about their asthma management. And we'd really be more than happy for you to use it as that kind of a tool to begin to talk a little bit about asthma control and how to ask a teacher or another child for help, or how to know if you're not feeling well, and just maybe also it's really nice positive reinforcement to know Ingrid's story and to know that actually 2 years ago she was having a really tough winter and a really tough asthma time in her life, and actually a really good GP review and a really good consultant visit made a huge difference to her. And I suppose that's really the kind of intervention that we find is really helpful. Now, Ingrid mentioned that she was talking to the nurse, but just to be sure so that people understand, really what we recommend is that mum or dad picks up the phone and talks to the nurse, or a guardian, obviously. And what we can do then is that the nurse might have a few pointers to give to a child alongside that phone conversation. So there might be a few minutes on loudspeaker with the nurse, but so we don't recommend that that children go off and phone the advice line in the same way as Childline or anything like that. It's a really good idea to have the nice sandwich with mum and dad, and to make sure that actually everybody's getting the asthma information that they need. But just to say thank you to Ingrid and to her mum and to her sisters and to her brother, who were fantastic when we popped out to them in Howth and were really supportive of our work, and who are a really good example of how we can get it right with a little bit of help and support. But what I'll do now, if it's okay with people, is I'll kick it over to Aoife to talk us through some of the kind of parenting supports that can be really helpful. And just to say thanks to Aoife for joining us, and I'll kick it over to you there, Aoife.
Thank you, Sarah, and I'm absolutely thrilled to be invited by the Asthma Society this evening to speak. I also had an opportunity to share my support last year as well, so I'm just thrilled to be back. Sarah has already introduced me, but I'm a parent and life coach of parent support. I'm a mum of 3, aging between toddler and preteen. My eldest just started secondary school last week. So I appreciate how busy life is for families. It's great to have you all on this evening. I also have family members that have asthma too, and appreciate, it's challenging times, particularly now, as our children, whether it be preschool, primary and our secondary school students as they return to school. It can be a daunting time and worrying both for parents, carers and the kids themselves. Just to give you a little bit of an insight of what I'm going to cover this evening for the next 15 minutes or so, sharing with you how we can emotionally support our children through the ups and downs, again, no matter what age they are. And again, that, having asthma as a big part of their lives can bring lots of different aspects and dynamics and lots of emotions. So I'm going to share with you how we can support our kids, as well as how we can empower our teenagers, because as Mary highlighted there, there's a lot that comes with it. There's a lot of the emotional, social and behavioral aspect for our preteens and teenagers that they take on themselves. And as a result, again, for lots of our children, and from the time the pandemic hit, so many families and parents, carers, children of all ages have experienced an element of anxiety, and it'll vary between one child and one family to another. But I'm going to share a little bit on that, how we can identify and build on our children's self-esteem, and then just touching a little bit on the return to school. So I've been supporting families for the last 20 years, and being a mum myself, I totally understand how challenging parenting can be. But when you have a child in your family that has asthma, what that can bring, and the anxiety and concern that it can bring, both for the parents and the children themselves. And like that, we all deal with things very differently, and even within a set of siblings, how they communicate, how they deal with conflict, how they deal with worry and anxiety, and how they mix their self-esteem, how they do in school. It's so different for every individual child. And I think, reflecting what Mary said, even when it comes to them dealing with their asthma, and the pace that they take can vary between one child and the next. So one thing I always share with parents is the importance of giving our kids that opportunity that they know we are listening to them and we're hearing what they say, because a lot of the time, particularly as our children get older, they start to feel resentment. They start to rebel because they're seeking control. They're seeking how they can, influence the situation. And there can be a lot of frustrations. And in a sense, then as the parents, we often feel like we're not in control because we're trying to manage everything, as well as support the child in question, as well as the siblings and family life. Just insofar as empowering our teenagers, and look, there's elements of this that's applicable to our younger children too, but the transition from primary to secondary is massive outside of health, huge big changes that our preteens and teenagers go through. Also going into the bigger exam years as well, there's a lot to contend with. There's pressure and there's an element of stress, which we'll all go through at some stage in our lives. But with secondary school for our teenagers, there's that extra layer of our children taking medication. And as adults and as the parents and carers, we worry because primarily in primary school, we could always keep an eye on the medication being taken in school. We had that kind of ease of communication with the teacher. Whereas now that they've moved on to secondary school, there's an element of worry that, are they going to know what to do? How are we going to support them in that? And for teenagers, they're a lot more self-aware and they want to fit in. They, for majority, don't want to be different. And when they know that there is this medical condition, they often do feel different. And as a result, it can come in the form of feeling angry, feeling frustrated, feeling an element of resentment, like I said. So it's helping and supporting your child. And again, no matter what age they are, but particularly as our teenagers can start to say no, and again, avoid taking their medication, that we want to form, good habits, create good routine, good practice when self-managing with, that designated adult within the school. If they are talking a lot, and Mary mentioned there about how they're getting frustrated because they can't do what their friends can do, whether it's sports, extracurricular, meeting with their pals, they're feeling somewhat isolated. So if you are hearing that negative talk, it's very natural and it's very normal, and it's part of them expressing themselves. Because often, again, and every parent and every carer on this call this evening, on this webinar, you know your own child best, and you know their coping mechanisms. You know what triggers them, and you know what can be not often a struggle for them. So it's exploring with them what is important to you right now, what is concerning you most in that, what worries you insofar you're missing, what you're missing out on. And that's reflective of our values, and we all hold values no matter what age we are. It's what's important to us, and when we live by them, life is that little bit smoother. But sometimes it takes us having that conversation with our children, no matter what age they are, and ask the question, what can we do to manage your asthma so that you will have a fulfilled day-to-day life, that you will get to be with your friends and have that that fulfillment as best possible. Often when our children don't feel in control of something, they seek out control in other ways. And sometimes it's not positive. Sometimes it can be negative. It could be looking for that attention. It could be just, again, down to that frustration. So like one thing, Sarah, you mentioned yesterday was kind of identifying who their asthma tribe are, and whether that is their peers, family, in school. Particularly with primary school children, it is the teachers, it's the SNAs, it's the resource teachers, the adults, the trusting adults there. With our teenagers, it's typically the year head, the form teacher, because they're ultimately responsible for your child and their well-being, in the day-to-day schooling life. And if they know that, they have a best pal that they can talk to, that understand, maybe they've grown up alongside them, knowing that they're taking this medication. I know, and I've heard even this evening about how for a lot of children, they're conscious of taking their inhalers. They, taking them in front of their friends, they're self-conscious. So it's working with them as opposed to telling them, this is what has to be done. And obviously, it's instilling some resilience, because we know we're not going to be always by their side and over their shoulder to tell them what has to happen. So it's giving them that empowerment and resilience, and trusting in their ability also, and providing again that opportunity to talk, and they feel like they're being listened to, and have them part of the conversation, have them part of the plan. And assure your child that it is okay to ask for help. It's kind of mirroring again, Sarah, what you're saying. No question, no concern is too small, and recognizing as well for them when they are not feeling well, and identifying the signs of when they know that they're not feeling right, and they need that help, and identifying an adult there that can help them, and who they trust and they feel confident in confiding in. So sorry now, insofar as with all of that, and I mentioned there about our children feeling anxious, it hasn't taken COVID and the pandemic for all of us to feel an element of anxiety, and supporting families, hundreds of families, even in the last 18 months. What's key is that we are our children's calm in a way, because when we're worrying, and we have every right to be worrying, if we are anticipating and anxious for them, our kids will pick up on that no matter what age they are. I always talk about us being tuned into the kids, but they are so tuned into us. They pick up when we are anxious and when we're worried. So if we can somewhat be calm for them, and again trust in their ability to manage and be prepared, again with our support, acknowledge and validate their feelings. And I mentioned the previous slide, frustration, upset, anger, feeling quite down. Acknowledge it. It's the same with ourselves. If we've had a really hectic day, if we're very overwhelmed, if we've had a tough meeting, and another adult comes in and says, do you know what, God, I can see you're really upset, I can see you're really angry. Often when we validate others' feelings, they feel appreciated and understood, and that brings in that whole aspect of our kids feeling like we are listening to them. When we actively listen, we're able to repeat what they say, name what they're doing, and name how they're feeling. Because sometimes when our kids are feeling angry, when that lid flips, all rationale goes out the window, all logic goes out the window. And it's very difficult in that moment in time, when that lid flips, that you can have that kind of logical conversation. So it's just something, to be mindful of. The basic signs of feeling anxious: headache, sore tummy, feeling sick, difficulty concentrating, sweaty palms. For our smaller kids, it's reluctance to separate, reluctant for us to leave them in the evening times when they're going to bed. Let your children know that you are there no matter what, that you are prepared to listen to them no matter how small or how big the problem is. Again, for our teenagers, often the reluctance to talk to us or tell us things because they're concerned as to how we react, how we respond. So letting your child know it is okay. Encourage, there's no one straightforward answer for dealing with anxiety, but is identify the triggers. Encourage them to talk to their friends, again, who are their tribe of friends. Encourage exercise, fresh air, healthy diet, omit screens from the bedroom, and get good sleep. And look at the kind of problem solving. What can they do? What would be helpful right now? Again, there's no simple, straightforward answer, but it's bearing in mind what is important to your child. With that, when our kids feel overwhelmed, when they start doubting their ability on every aspect, if they're concerned about going back to school and they're panicking already about what if I have an asthma attack? What if it's too quick and I'm all of a sudden feeling sick and I don't get to an adult? They start to doubt their ability. And again, it's just reinforcing, what needs to happen and have some kind of a plan in place, but identifying their strengths. Again, what's important to them, what might be helpful when they are feeling overwhelmed. I kind of talk about using some lovely affirmation cards, and you'll see there even in my next talk. And just for anyone, for children of 6 to 12 years of age, this book here, What to Do When We Worry Too Much. A Child's Guide to Overcoming Anxiety. Fantastic book. I'd recommend it both professionally and personally. My older two used it. Suitable for children between 6 and 12 years. Some lovely affirmation cards here, and I mentioned there, practice positive affirmation cards. I might share even with Sarah or the team just on a couple of resources that I'm sharing. Maybe it's something we could follow up with. Some lovely Happyosity, lovely Irish company, Emily and Eve. But these are all about sharing with our kids, just turning that that kind of negative talk, which they can find themselves doing. We're all guilty of it, but positive affirmations is changing that way of thinking. You'll see there just some examples, but just even going back to routine. Routine creates predictability, it creates consistency. Children really thrive in routine no matter what age they are. So even when it comes to sleep, and again, good healthy diet, you'll see there the recommended hours. Omitting screens, like I mentioned there, it's really, really important, because that will reduce anxiety and again encourage a better sleep. So I'm conscious of time, as I know there's still some more to go on, but I'm hoping that you find something out of this evening from all of the speakers that will help in some way. Like that, my website is parentsupport.ie, and I have a lot of resources on my Instagram page @parentsupport as well. So yeah, listen, the very best of luck as we enter into a new school term, and yeah, thanks everybody.
Thanks, Aoife. That was great. I can see one or two comments and questions coming in there where people are saying that they'd love to get those resources from you afterwards. Just maybe to reassure people, the first thing is obviously that we're recording the session here this evening, and we will be sending that recording out to any people who've registered for the session. We'll also be uploading it onto our website and to YouTube, so that people can download it and can access it after the fact, because we obviously know that 7 p.m. in the evening is a pretty premium, pretty busy time in this particular week, and we're really aware of that, so don't worry. The second thing is that any people who've registered for the webinar, myself and Martina, who works with us, and Ellen, will be sitting down tomorrow, and we'll be going through the list of resources that we have. So we'll be sending an email out to everybody who's registered, which will include the stuff that Aoife has mentioned, the PowerPoints from tonight, and things like our kids' booklets, and any materials that we think would be really good and would be really helpful for yourselves. If when you're going through any of that stuff, when we send it out to you, if you come across a gap in something where you're like, oh, I really wish I knew X or Y, or gosh, I have a question about some piece, first of all, obviously let us know, because if we're providing you with materials and if there's something we've missed, we'd love to know that so that we can improve them for further reference, but also we can steer and direct you to the other resources or to our services as we go. But don't worry, those materials will be going out to people, and just obviously I know in one of the chat session messages somebody just there has specifically said that they really want to make sure that they get that, so don't worry, we'll send it on to you. If it's okay with people, what I will do is I'll kick over to Samantha. Samantha had pulled together a few slides, but what we might do is the quick fire version of Samantha's chat. She'll just talk you through the background of some of the services that we provide, which might be helpful, because as I can see the questions coming in either advanced or today, a few of those kind of might be really helpful for people to know about now. And then what we'll do is we'll try and take the questions thematically if we can, and we'll get the panelists to answer them as we go. But I suppose the really important thing from my point of view is, like, we're here to help and support you. That's what we do every day of the week. That's what gets us out of bed. And Samantha will talk you through about how that is practically. And then if there's any bits and pieces that occur to me afterwards in a kind of a mad, disorganized, scattergun version way, I will reiterate and we'll kind of flag those with people as we're going, if that's okay. So Samantha, I'll kick over to you if you're okay to go.
Hi there, sorry, I think Ellen's going to share the screen for me. But basically I'm going to talk about what we have to offer in the Asthma Society for you. Just hang on there a second. Right, so we have what we've done up is a September survival guide, which basically goes through a step-by-step on tips, what you can do, getting your child ready to go back to school and to control their asthma, and all various things that I'm not going to go through the whole thing because obviously we're short of time anyway. But this can be sent out to anybody. It's on our website. Our website, asthma.ie, is a brilliant resource for information. You could spend time clicking through it. There's loads of info. There's loads of information leaflets to download. There's a kids corner, which is really great for the kids to get involved, because it's important they get involved if it's their condition as well. But then we also have the advice line, which is run by asthma specialists, and how it works is you ring in between 9 and 5 Monday to Friday to a reception, and they will take your details, and a nurse will ring you back, and a day and a time that suits you. Now that could be an evening, it could even be a weekend sometimes. So, and you get a half an hour call, and then you can get repeat calls. So that's the advice line. And as Sarah had said at the beginning, no question is stupid, because really and truly, when you've got a child with asthma, it can be quite a daunting time. So ask anything. We've heard everything, and we can deal with most things. So apart from the advice line, we also have a WhatsApp messaging service, and the phone number, as you can see up on your screen now. So you can message in. Again, that's Monday. I work on that as well, and that's on a Monday to Friday as well. And you can WhatsApp a message into us, and we will come back to you with some standard questions, and then we can get into the questions that the quick query you're wanting. We can also have, on the WhatsApp messaging service, attach links for leaflets and different things. So any resource you might want, we can actually attach that with the WhatsApp messaging service. So that's really well worth using. So really, that's it. I'm just going to do that because I know we've got an awful lot of questions, but there's an awful lot of information on our website. So please feel free and contact us on the advice line or the WhatsApp messaging service. Thank you.
Thanks, Samantha. And I'm sure it's lovely for people to put a face and a name to some of the nurses that they deal with through our services. If it's okay, I might just reiterate, because we did a teachers webinar in June, and what we found was really helpful actually was, in the course of the conversation on the webinar, we talked a little bit about the practical ways that both Advice Line and the WhatsApp service can actually really help people. So if any of you are worried at the moment about your child going to school and about whether they understand the basics of the 5-step rule, if they're a child who may have experienced an asthma attack in the past, if you send a message to the nurse WhatsApp service, so that's on 086 059 0132. If you send that message on the nurse to our WhatsApp number, either Samantha or Ruth, depending on who's working over the next few days, will send you back a reply, and they can send you on an image of the 5-step rule, which you can then click save on and save down onto your phone. They can send you either the adult video for how to manage, well, it's child over 6 or adult. So they can send you that video for how to manage an asthma attack in a child who's over 6 or an adult. If your child is under 6, they can send you the specific video that's appropriate for a child who's under the age of 6. And they can also send, Ingrid's video. Like I said, if you want to kickstart that conversation with your child and talk about, look, last year maybe wasn't great, and let's see how we'll listen to Ingrid and see what she says about our asthma management and where we can go from there. And what we found was that the teachers were absolutely suddenly thrilled to realize that the WhatsApp service is there any time of the day or night. You can send the message. Obviously, Samantha and Ruth work 9 to 5 Monday to Friday, but if you send the message at 3 p.m. on Saturday, when the girls are back on, or the ladies are back on, depending on how you prefer to interpret, when the team are back on, they'll send a message on Monday. They'll send you through any materials you need, but they'll also answer your query. And what we often find is people think, oh, I just have one question to ask about asthma, and they'll send a message to Sam or Ruth. And actually what happens is, over the course of 4 or 5 days, they might have 20 or 30 messages back and forth saying, oh gosh, that's great, I didn't know about that, or I'm also worried about allergy testing, and what do you think about allergy testing, and should I be checking about dust covers for my bed, or how does this work in terms of talking to my child, as teachers at school, that kind of stuff. And essentially what Sam and the team, whether they're on Advice Line or on the WhatsApp service, find is really the variety of messages we get is really broad, and there is no bad way to start this asthma management and asthma support conversation. If there's one bit that's in your mind, send us a message. You might be surprised that actually, you think you just have one question that you want answered, but there might be a bit of repetition or a little bit of background or explanation that the nurses can provide that really does a really good job. And I think what people find as well is sometimes children's asthma can be quite seasonal. So the idea that you do a little bit of a refresh around September, is actually really convenient and really handy. If you phone through for the Advice Line, like Sam mentioned, you phone through on 1-800 44 54 64. It's probably Ellen who'll be taking your call, and Ellen will pencil you in for an appointment over the course of the next 2 weeks. Now, we're quite busy for the next 2 weeks, so just to let people know, if that's the case, Ellen will take your details and we'll pencil you in thereafter. We're actually recruiting nurses at the moment. And so just don't get worried if we're too busy in the next week or two, just because things are pretty jam-packed with the back to school period. We will come back to you and we will get you sorted, but Ellen will talk you through what times are available over the course of the next 2 weeks. And obviously, as Sam mentioned, like oftentimes people phone us, they think they have one question, it turns into a full half-hour appointment. Then actually afterwards, you know, Samantha might follow up and might say, look, I think there might be a particular bit around, you know, the GP review that you're going to do in the next few weeks that you might want a bit of help and support around that. Or I think you might find, you know, when it gets a bit colder in November, it might be worth doing another refresher. And those calls are all free. We're here to help you with any of those. So,
and sorry, Sarah, just to say, if you are waiting for an advice line call, use the WhatsApp messaging service in the meantime, because then we can come back. Now we you know, it does say on there that we will get back to you within 3 working days, but we do get back to you within the same day. So obviously if it's in the working hours. So if you are waiting for an advice line call, that doesn't mean you can't use the WhatsApp messaging service as well.
Yeah, sorry, thanks for that, Sam. That's very practical. Of course, I think people know that, but they don't always know that. So when you send in a message into the WhatsApp service, you'll get an automatic reply. As Sam mentioned, it'll say we reply within 3 working days. That's basically in place so that you understand that, for example, on a bank holiday Monday, you won't get an immediate reply, but mostly those chats happen back and forth in the same day. But we've no problem if you only have time for 20 minutes at lunchtime and the conversation spans, you know, 5 or 6 lunchtimes. That's no problem whatsoever. The point about the messaging service is actually that it's the help right there to your phone, in your life when you need it, and that's one really positive thing that people find from it. But if it's okay, what we'll do is we'll kick over to some of the questions which are really great. Now we may not get a chance to answer all of them, but you forgive me for a second, I'll just disappear into one of the Word documents that Ellen pulled together here from the replies she got from you, and we'll just ask a few. So we might just pull out one question in particular. It's come from Antoinette, Mandy and Sylvia. And then I noted this evening that one of the anonymous questions is a little bit about it as well. Natasha was also asking it on the chat service. So that is essentially, will my child grow out of asthma? What does it look or feel like to have a child who grows out of asthma? And one of the questions specifically was, like a child seems to only have asthma in winter, and will they grow out of it? Or how would somebody recognize that a child is growing out of it? And what's the appropriate GP structure or GP review structure to surround that? So if it's okay, Mary, I might kick that over to you from the get-go, just because I do think the basics of does a child grow out of asthma and how will I know when that's happening would be really useful for people.
Yeah, okay, so there's a, you could talk about it for a while, but to try and make it succinct enough, some children do grow out of asthma. It can be difficult to predict who will and who won't, but there are certain types of asthma that are more likely to persist than others. We divide asthma into what we call phenotypes, so it's different types of asthma. So children who have seasonal asthma that's viral induced may be more likely to grow out of asthma than children who have allergy mediated symptoms that are allergic to pollen, that may have associated comorbidities or other illnesses such as food allergy or allergic rhinitis. So they're both kind of ends of the spectrum, and then there's all that goes in between that is variable about that. But the difficulty, I suppose, is how do you know when somebody has grown out of asthma? And it's not a turn on the light moment. It happens over a period of time whereby you notice that somebody is becoming more symptom free. They require less unscheduled healthcare visits or visits to their GP or the emergency department. They need to use their Ventolin less. And if they're okay for a number of months, you consider reducing their medications. And if they stay well, then for a further few months, you can reduce it even more. So it's a kind of a step-by-step approach, going through those steps that I'd spoken to you about earlier on related to medication treatment that is increased or decreased according to need. So I suppose if you think about it as well, the prevalence of asthma among children is somewhere around 18%, right? You know, went up to above 20% at one stage. And among adults, it's approximately 10%. So, you know, about a half maybe a little less than half of children grow out of asthma. So as I say, it's not, an easy question to answer. It's hard to predict. It does happen. It needs to be monitored and supervised. Not to do something too suddenly. It probably will be confirmed over a year or two. So I don't know if that gives you an idea, but I think just to keep it short, I'll leave it at that.
Okay, just maybe to reiterate that point, for any person who thinks maybe my child conversation about this, obviously either our WhatsApp service or our advice line service are a really good opportunity for any patient to maybe tease that out a little bit and to understand a little bit more about what to look out for, and also how to engage with that in a very safe way, because the last thing we want is that you get an inkling maybe they've grown out of it, that you change any medications without the help and support that you need, and that your child doesn't feel well suddenly. So that's the real watchful piece, to make sure that that you engage with that in a really safe way. And obviously the nurses are really expert and really ready to have that conversation and support you through it. So we wouldn't recommend that people make any changes without really having really good healthcare professional support, whether that's at nurse, GP or consultant level. Can I just say, one of the other questions that has come through here is in reference to Montelukast, which is one of the medications around asthma. So one person has asked a little bit about the concerns or side effects about Montelukast. Now, what I'm recommending is that any person who sent us in a specific query about medication, I really think it's a great idea for you to use the WhatsApp service or the advice line service to give us a call, so we can have a really good meaty conversation with you about that, to make sure we were giving you the right information for your child, because a 2-line question and a 2-line answer won't really work in terms of a more complex or technical medication question. But that one about Montelukast and side effects, Mary may be able to answer pretty quickly, I expect.
Yeah, well, Montelukast is what you call an anti-leukotriene receptor antagonist. So what that means is it acts on a particular inflammatory pathway that causes inflammation in the nasal passages and the lungs. And you're cutting off that pathway so that you reduce the inflammation. So the side effects that are associated with it that occur in a very, very small percentage of people are rash, nausea, headache, night terrors, change in behavior and mood. So some of these side effects are, worrying for parents. So what we say is that if they develop any of the side effects, particularly the kind of night terrors and change in mood, etc., just stop the medication and let us know. So from that point of view, the side effects will stop if the medication is stopped. But it is important to remember that Montelukast is a very useful medication because it can be steroid sparing. In other words, it can help gain further control of asthma symptoms, allowing you not to have to increase the inhaled corticosteroids more. So it's worth a trial if your child fits the profile of patient that would respond to that. If they're going to have the side effects to Montelukast, they usually transpire fairly quickly. And like that, as you said, Sarah, like any changes in medication should be medically supervised, so that if you're changing medication, reducing medication or increasing medication, it should be done in conjunction with your clinician, whether that's your nurse, your GP or your consultant. So just to make that point. And if medication is stopped, inform your clinician.
Thanks, Mary. Mary, a follow-up question here from Sylvia about the diagnosis piece, which is she's asking why GPs don't send children for more detailed investigation, but instead prescribe asthma inhalers based on the questionnaire or that medical history, that conversation only.
And that can be done. I mean, like GPs are going to manage, according to Sarah, the model of care that has been developed for asthma nationally. Like most of asthma is going to be dealt with in the primary care or the GP setting. And they don't have the resources or access to all of the resources that there might be in a hospital. And they can confidently, in a fair amount of cases, make the decision whether somebody has asthma based on the clinical picture, the symptoms, the response to medication, the family history, and the response to medications. And if it's mild enough asthma, then that's reasonable, I think, to do. The lung function test, an objective test, is not going to be done until they're over 6. And even in some hospitals within the country, they don't have access to lung function testing for children. So it's kind of reserved for the more severe end of the spectrum, shall we say. And then allergy testing, again, there's different types of allergy testing. The ones most commonly done are skin prick testing and blood test for what we call IgE levels. And again, these tests are done in secondary care or in hospital, and GPs don't have ready access to that. Like, you know, there might be some GPs who do skin prick testing in their own surgery, but they need somebody who's kind of qualified and has the ability to do it. So it's reasonable, but if things are not settling, if symptoms are not improving, then certainly I think it will be acceptable to be referred into a specialist for an assessment if the GP's approach wasn't working.
Okay, thanks, Mary. I think that probably is probably quite helpful to solidify the piece you had presented to us about diagnosis. Joanne has asked about how she can get the solution for her son's nebulizer lately. She feels that he's needing his nebulizer a lot. I think maybe if it's okay with you, Mary, I might just say that I think if anybody is observing like this, that they feel that their child needs a lot of the medication or an increase of the medication, I think our straightforward advice would be pick up the phone and speak to us if they would like to speak to us, either through advice line or WhatsApp. Pick up the phone and make an appointment with your GP. When you're observing things like that and you're seeing your child they're getting better, they're getting worse, they need more medication, or you notice a really kind of sharp increase in symptoms, we just think that it's a really good point to intervene straight off the bat. So Joanne, we're here if you need to give us a call, and we're happy to do that. And then obviously if you see somebody's experiencing a sharp increase in symptoms, you think that's you know, either that they're getting worse or that they may be having an asthma attack, what we really think is very important for people to understand is that our advice line is not an emergency number. It's manned 9 to 5, and for example, Ellen isn't a nurse on the end of the phone who's the person who'll be taking your call. So what's really important is if you see anybody having an asthma attack, or if you need emergency care, that you're calling 999 or 112. Any of our materials will include that message, but we think that's really important for people to know. Michael has asked a question here, and I'm just going to...
Sorry, Sarah, can I just say, because I just think it's important to follow up that if somebody is using a nebulizer, they're using a bronchodilator in it, and an overuse of bronchodilator is associated with severe asthma attacks, and it's not really recommended. So I would urge that that lady maybe to call to her GP and just get an assessment. I think it's the safest thing to do. Sorry now to interject.
No, absolutely not. That's great. I mean, I suppose I don't want to cause any fear or anxiety in people if they're, but I think the simple message is when you're noticing something like that, you really respond. And I think you don't have to worry that your GP or anybody in our service or any person who's dealing with asthma will have a negative reaction to that. I mean, really what you're trying to do is to keep them safe and to keep them well. So if you have a worry like that, that's based on either an observation of symptoms or medication use, we just really think it's a good idea to respond really quickly. Michael has a question here, which is that he has observed a child with poorly managed asthma and that parents are unwilling or unable to provide an inhaler medication at home. And it sounds to me like maybe Michael is a teacher or somebody in a teaching setting, or else is observing a child in another healthcare setting. And is there a support avenue? I mean, it's a really tricky one, Michael. And if you have a concern about a child and their medical well-being, obviously having a conversation with the parents is one engagement that we would recommend. If you're concerned about their asthma management or their asthma control, you know, we're happy to take a call from people and to see if we can tease out maybe the next best steps, or another parent or responsible adult in that situation who may be able to engage. And we can obviously give you information and support and guidance so that you can go back and have a good conversation with a parent or guardian like that, because obviously the child's health and well-being, you know, is of absolute premium importance, and their asthma management, you know, is a really big part of that. And so we can provide you with support, but we can also signpost to other services that can do the same to make sure that you're able to have a good conversation. Mary, one here, sorry, and I'm dealing with some of the medical or medication ones in the one go, so that's why I'm liaising with Mary just back and forth. And Marie has asked about her child's triggers when running or laughing, and she wants to know, does that mean that their medication isn't strong enough, Mary?
It doesn't necessarily, but I had mentioned exercise and emotion, which could be crying or laughing, as a trigger for symptoms. But it could be an indicator that the asthma is not fully controlled, and there may need to be an increase in the controller medication. But there is the best way to kind of assess this is to do a clinical assessment and see, to tease out further what symptoms are going on. They may not be the only isolated symptoms. There may be, I mean, think about when was the last course of steroids or antibiotics needed? Does the child have a cough that maybe occurs during the day or at night time, is dry? Does the child ever have a wheeze outside these times? And things like nasal symptoms, runny nose, blocked nose, itchy nose, and is the child allergic? So there's an assessment there that can be made, but the short kind of solution is to take Ventolin before exercise, which is routine enough to take 2 puffs about 10 or 15 minutes before playing a game of football or tennis or whatever, if that is causing you symptoms. But if the exercise symptoms were inhibiting you and affecting your quality of life, I think it's time to talk to your clinician.
Thanks, Mary. I think one for Aoife here. So Fiona has asked about, asthma and anxiety. She mentioned that her child had a severe attack at the end of the school year, and she wants to reassure her child as she's returning back to school, and she's very anxious. I'm just wondering, Aoife, do you have any suggestions there about what might be helpful for that, for Fiona?
I think, obviously there's now a strong association held for that child to what she remembered as she finished the final term. I think reiterating what I mentioned there earlier about, validating feelings, which is really important, acknowledge that how she's feeling, and that's okay, give her the permission that that's okay, and then really put a plan in place, because kids like to know a plan. They cope a lot better when they know what to do. And I suppose it's identifying the adults in school. I don't know whether she's in primary or secondary school, but identify someone that they can go to and, recognize how she was feeling during that time, at that period. Again, recognizing the signs. And it's more so that she knows who to talk to, and ideally to take that on there. But certainly the big thing is acknowledging with her and having that kind of problem solving, like what is her triggers again, and what would be helpful for her. That's what I would be kind of recommending. And I do have, just as part of the resources, I do have a lovely handout from the Department of Education on supporting our children who and our parents who are experiencing anxiety or who are anxious. Maybe that's something parents might be interested in me sharing also. I can talk to the girls about that.
Great, that sounds really helpful, I think, Aoife. And Sarah has asked about her son who's becoming self-conscious about taking her inhaler at matches, and she's wondering how to help him deal with that. I suppose maybe, Aoife, I mean, when we talk about building the asthma tribe, it's one of the things we find can be really helpful. So, the more open a conversation can be had with a team, with a coach about asthma, the more the other kids are aware of it, and that it's quite normal, or quite normal for a child to need to take their inhaler, so that instead of it being something that they hide in their duffel bag and they kind of sneak around doing that, instead it's like, oh, Dara or Joe or Gemma, for example, needs to take their inhaler. You might see them do that. That's because they have asthma. Did you know about asthma? If you think Dara or Gemma or Joe need any help, come over to the coach. You should recognize it, and it's as open and normal as any kind of engagement with a child.
That's I would definitely mirror that, Sarah, and that it's just kind of normalizing it, and because again it's how kids feel, and that they're different to everyone else, and that sometimes doesn't feel good for them, but by normalizing it and opening out into the bigger group for conversation and awareness, and if that's even within a school setting, in a sports setting, would absolutely reiterate what you said there.
And just, Sarah, if you're watching, we have a really good Reach Your Peak booklet, which is all about asthma and sport and its relationship with sport, and how to manage sport and get the most out of it, or any kind of exercise realistically, not only team sports. And you can send us an email into the Asthma Society, and we will send you out that booklet, and also maybe some materials so that you can put a 5-step rule poster up in the local club, and also maybe some asthma attack cards so that you can kind of kickstart that conversation with the coach. Previously, we did have some funding from the HSE and from the GAA to run an asthma friendly clubs program. We thought it was absolutely brilliant. We would love to do more of it. Unfortunately, we don't have funding at the moment, but it is something we would hope to be able to do in the next 6 months, 12 months, 18 months. We really think it's so important, particularly as Mary mentioned, you know, between 18 and 20% of children will have asthma at some point in their life. So that's 1 in 5 kids. So the more they are safe in their full environment, whether that's at school, at creche, you know, at play dates, in their club, in their hobbies, you know, the less we all worry about asthma and it being unmanaged. If it's okay with people, I might just from that just answer 2 or 3 questions that people have asked about our schools program, because it kind of relates a little bit to that. Marketa has asked about how to deal with an asthma attack in primary and post-primary school. Marketa, I really strongly recommend that you send a message to the WhatsApp service, and either Sam or Ruth will send you on the details about the 5-step rule and how that works for a child under 6 or for a child or adult over 6. We also have a 5-step rule card that we can send you out by email at the moment until the office reopens with the COVID restrictions, and we have some really good graphics around that should be really helpful. Everybody should know about the 5-step rule, and everybody doesn't know about the 5-step rule. I suppose it's one of our greatest concerns that we have a condition as prevalent as asthma, and that people don't know the basics about how to manage an asthma attack. And that's something we are really lit up about and really fired up about and trying to get changed in the country at the moment. Regina has asked about if it's okay for an 11-year-old to have their inhaler locked in the first aid box in the staff area instead of with the child or in the room. We really, Regina, would prefer that a child, that you and your child can have a conversation with your teacher, can have that asthma inhaler available in a lunchbox with a sticker on it in your child's classroom, so that it's close at hand if the child needs it, and so that you're minimizing anything to do with that stigma and that embarrassment about needing to ask for it, and that you're not making it so that a child feels like they have to be making a fuss to get their inhaler, and also so that the teacher is properly supported and knows the good basics about why that child needs to have it near them, and that the child isn't creating a fuss. We had a little bit of funding earlier on this year, and we ran a new version of our schools program. It's called our Asthma Safe Schools program, and that is all about keeping children safe in school. We have a worry, and it's kind of based in evidence from that program, that teachers feel like the school is not as asthma safe as they want it to be. So we had feedback and surveys from principals and from school teachers to say that they felt like they didn't know enough about asthma. They didn't feel like they had enough support materials. They felt like they didn't know the asthma basics as well as they would like to, that maybe they didn't have an asthma schools policy, and also that they didn't have the training, or that they didn't have an emergency inhaler available to them in the classroom or in the school. And those are things that we feel very strongly about. We will be lobbying all of our politicians, including our Minister for Education. We hope to get a meeting with them in the coming months to talk to them about the findings of that research from the pilot Safe Schools program we ran earlier this year. And we are hoping to lobby and to get funding to run an Asthma Safe Schools program, so that every single school has an emergency inhaler, so that the staff are trained and they know how to use it, and so that your child's school environment, where your child is looked after in loco parentis, that's a really safe schools place. So Regina, we are on it. We are doing our very best. We really care about it, and if you want to come on board and support us, obviously, you know, send us an email after the webinar. There are ways that you can communicate and can lobby your local TD to talk about why that's important. But also, if you want to donate to us to support that Asthma Safe Schools program, that's something that we're going to be fundraising about in the next number of months. You can go to asthma.ie, and every donation that you make can make a big difference to us being able to get that program off the ground and up and running, instead of it being a pilot schools program in 32 schools, that we get it in as many schools as possible. And Grace's question is, how safe is my child in school? And I suppose, Grace, just reiterating, our answer to that is, you know, comprehensively across the board, not as safe as we would like. There may be some classrooms where teachers know enough, they have good supports, they've been through our Safe Schools programme, they may know enough about asthma in their own personal lives, their own family lives, and they may be a brilliant asthma guardian for your child in the classroom, but that's not consistent across the board, and it is a big safety concern for us. So that is something that really is driving us and will continue to keep us going, let's say. I do have some questions here about vaccines and COVID-19 vaccines, and so I might kick one or two of those over to you, Mary, if that's okay. So Karen and Jennifer are asking about if there's any information yet about vaccines for kids under 12 with asthma, and people are also asking, would you recommend it for kids, a child of 12 years or under? Mary, I don't know if you have any details you'd like to talk about that.
Yeah, the HSE hasn't said that they're rolling it out, but I suppose maybe I would think that it's quite a possibility going forward. But it's 12 to 15 year olds at the moment, and I suppose the way to look at the vaccine is to look at the risk versus the benefit. So the risk of not getting the vaccine means that your child could get COVID, and if your child gets COVID, then they're going to miss school. And although the children who get COVID don't tend to get it very bad, they tend to get mild forms of it, but still, if they are positive for COVID, they're going to have to stay at home. There are some things that are in relation to COVID. Long COVID can be an issue, so we don't know if somebody gets COVID, how they're going to be in months to come. And then there are some very unusual kind of complications of COVID that can occur and can make somebody very, very sick. But as I say, in children who get COVID, generally they don't get that sick. The other thing about COVID is that you can be putting your family members at risk if you're not vaccinated. So then if you think about that, and then you look at, okay, so what's the benefit of getting vaccinated? The benefit is that you are going to be in school, you are going to be able to go out and about, you're not going to be at risk of serious complications, and you're not going to develop long COVID. From the risk of the vaccination, the risks are pretty low. They're very low. There are some side effects around and heart side effects, but they're very minimal. And I suppose what one has to do is think about this in relation to, as I say, the benefit versus the risk. And it is, I suppose, a personal decision. But, you know, as I said to somebody today, like we ask parents of children, are all your vaccinations up to date? It's a routine question. And every child in the country has had, well, almost every child in the country, practically every child in the country has had numerous vaccinations through the course of their life, including the flu vaccine. I can understand that a parent could have worries about whether they should, in case their child was the one who had the side effect from the vaccination. But the general advice is, yes, do get a vaccination. Now, am I answering the question, or have I gone off on a tangent there?
Well, no, I mean, I think that answers one question, and I think it answers the follow-on question that I have in the mix here from people either on the chat service or in advance of the webinar, which is, what do you think, what's the recommendation? And I suppose what you're saying there, Mary, is that there are really strong messages around why vaccination is a really powerful health tool, that there are some risks involved and that the evidence looks to be low. And if really this is all about we call vaccine confidence, isn't it? And if people are concerned about that and they want to get, you know, some information, reassurance, guidance, advice, I know that our nurses are dealing with it on advice line, but you can also phone your local GP and have an appointment with them to discuss it. If you're under the care of an asthma nurse or a consultant, they will also provide information if parents are very concerned about it. So there are supports in place for people to have that conversation where they need to, where the vaccine is available. And obviously, as Mary's mentioning, you know, it is moving down the level in terms of age groups at the moment, and we'll see what the next steps are. I'm aware of the fact that we've gone over time, and I know that there is one major query that's in play. So I'm just going to ask Mary about this, if it's okay. So we've had it from Laura, Jackie, Deirdre, Sarah, Adrienne, Rita, Michelle, Lucy, Catherine, Lucy, and Bridget. And there's two parts of the question. The first is, should a child be wearing a mask in school? Do you recommend it, particularly for children with asthma? And Lucy is asking, are there any recommendations about the best types of masks for children?
I'm probably not the best placed to ask this, because this is more kind of a HSE kind of Department of Education remit. And I suppose in the schools, what's happening at the moment is they're in bubbles, and then they're in sort of groups of 6. All the teachers are vaccinated. Like, I can understand this question being asked. I suppose over the past year or so, a lot of children didn't get the normal viruses that went around because they were wearing the masks and they were washing their hands and they were isolating. And there's, you know, a few factors that contributed to children not picking up the normal viruses, which might be adenovirus or rhinovirus, just a normal common cold that might trigger off an asthma flare-up or asthma symptoms. I think I would have to say on this that I can't give advice on whether nationally children should be wearing a mask. I think we have to wait to see what the HSE advises. You know, again, I suppose it's down to a certain amount of what the parent wants the child to do. But I would say go onto the HSE website for reliable information, and that you can inform yourself in the best way, so that you have 100% correct information and not my opinion as such, if that's all right.
Okay, so I think first of all, we've had too many questions to be able to answer tonight. So I think what we're going to do is we're probably going to go and take away the questions that we've received and figure, have we covered all topics, or the things that we haven't answered? I think Mary's point about the masks is well taken. So we participate in a stakeholder group where the HSE talk through the changes as they're happening and the guidance and advice. I think we will probably try to go back to that group to see if we can get answers to some of these questions, specifically about people with asthma, and we will keep you up to date, whether that's through a Facebook Live or an email or a members newsletter going out, because we want to make sure that we're giving you the best possible advice, and that's based on the medical evidence, because that's really who we are as an organisation. We're really led by the medical evidence. What I would like to do is just to flag the piece that Samantha shared briefly on screen with the back to school checklist. We have that as a PDF, but we also have it as separate images for each of the particular chunks. If you send us an email or a message to the WhatsApp service on 086 0590132, and you'd imagine that I say that enough times every single day that I would know it off by heart, but I have to check it every single time. If you send a WhatsApp message to that, we will send you through the images of that particular resource to make sure that you have them. And that can be a really handy thing to save down through and to go through anybody at home to make sure that you're happy that actually you're doing the best practice stuff in terms of back to school to manage and guide your child. So we'll have a look about doing a follow-up in terms of getting you the answers to the questions. We really appreciate your time tonight. I know people are mad, hectic, busy these week or two. We will share the packs with you by email, and people have sent on some really helpful feedback and advice, for example, saying that the 5-step rule card, that the text is too small. I agree. So we're trying to figure out about what kind of space and navigation that needs to have and how to use it as best possible. So we'll try and figure out about that. feedback like that is always really helpful from people, so thank you. We also have a really nice animated 5-step rule video, so we'll be sending that out to you as well. And any of these, like I mentioned, are pieces of content that Sam or Ruth can share with you on the WhatsApp service if you want to send us a message, and we'll send them through. And also that the nurses can send on as an email after you have your appointment with us on the advice line. But just to say a really big thank you, first of all, to Trudell Medical, who are helping and supporting us with our back to school campaign this year. It's obviously quite a bit of work to get the webinar up and running, to get the checklist there, to get all the websites sorted, and to get the supports in place to make sure that we can give you a hand in the ways that you need as a parent or a guardian or a teacher. The teachers webinar will be coming later this month, and we'll send you all an update on that so that you can flag it with any of your teachers to make sure that they're as informed as possible as well. I would like to say a huge thank you for giving us their valuable time this week, and that's to Samantha, to Aoife and to Mary, and also obviously to Ellen and Martina on our own team. Big efforts gone into making sure that people know about this and they're aware of it and that they get the help and support that they need. Just to say, we really appreciate their time and we appreciate your time. And obviously any emails of feedback or thoughts welcome on how we can do this better in the future. And we will be in touch about the next steps to make sure that we get your questions answered and get the supports that you need. But just to say good night and thanks. And sorry, I realized I had been sitting there almost largely in the dark. So I'm now sitting under a very bright light. But thanks to everybody for their time, and stay safe this week.